Hello everyone. Welcome to part 2 of the presentation on the Bethesda category called Negative for Intraepithelial Lesion and Malignancy, where we look at some of the organisms which we encounter in cervicovaginal smears as well as some cytopathic changes associated with them. For obvious reasons, changes related to human papillomaviruses will not be a part of this presentation and will be discussed under epithelial abnormalities. So what is the value of identifying organisms or relative cytopathic changes in cervical vaginal smears? One should remember that the identification of organisms have a pretty good specificity, and therefore it has an important role in alerting clinicians about unsuspected infections, wherein the clinicians are going to confirm the findings that we report on cervicovaginal smears through additional means. However, it has low sensitivity, and therefore cervical cytology is not the ideal method for screening for these organisms. The sample from the liquid-based cytology vials, if you are using liquid-based cytology, may be used for cancer screening and for testing for organisms like gonorrhea and chlamydia trachomatis, apart from testing for HPV. The reporting of additional findings like organisms or other non-neoplastic findings is considered to be optional according to Bethesda. However, a close communication between clinicians and cytopathologists regarding reporting protocols is desirable. So the first organism that we are going to look at is Lactobacillus or Doralines bacilli. These are present as these structures, rod-shaped structures, and they are present on top of the squamous cells, even glandular cells, and they're also present in the background. They're a part of the normal vaginal flora, and they tend to be particularly prominent during the first 9 to 10 or 12 days of the menstrual cycle. What we see over here is something which we need to report. That is, if we find anything on the cervical smear which suggests, and this is very important, a shift in the bacterial flora, suggestive of bacterial vaginosis. Now, one of the key features of identification of this condition is the presence of coccobacilli, and this coccobacilli tend to be present on top of the squamous cells. They seem to be limited by the boundaries of the squamous cells. They cover the cytoplasm of the squamous cell. They go on top of the nuclei too, and these cells are called clue cells. Now, those of us who look at cervical smears as conventional preparations would be more familiar with the picture to your right, where you see the clue cells, but along with that you are going to see the coccobacilli forming a kind of a curdy structure in the background. However, one must remember that when we look at the same on liquid-based cytology preparation, this kind of a background is often absent. So in such cases, the background is clean, and these coccobacilli tend to be present more on top of the squamous cells. Over here, a very few cells are present in the background, as you see in conventional preparation. So this is a very, very important point to keep in mind. Now, this is a kind of a representation which I have put together. So the normal vaginal flora comprises of lactobacilli. It is absolutely fine to have that. And there is a shift in vaginal flora. We see coccobacilli, and one of the markers or one of the identifying features of this condition is the presence of clue cells. So these are some of the notes which I have put together as far as the shift in vaginal flora is considered. Now, lactobacilli are gram-positive anaerobic bacilli, and as I've said, is a part of the normal vaginal flora. A shift in the vaginal flora, this is very important, a shift in the vaginal flora from lactobacilli to coccobacilli is suggested by the predominance of coccobacilli, and these amongst others include Gardnerella vaginalis, which is possibly the one which is most well known, Morbulunca species, amongst others. Now, if there are a large number of inflammatory cells in association with coccobacilli, in absence of lactobacilli, it indicates a vaginitis rather than a vaginosis. So I think that is self-explanatory. Now we use the word suggestive because the presence of coccobacilli, even in the absence of lactobacilli, is not a confirmation of a shift in flora, because a specimen obtained from one site is not representative of the entire vaginal flora. Gram stain of vaginal secretions and cultures are often used for confirmation. However, it is important to report it saying that there is suggestion of a shift, because bacterial vaginosis is associated with pelvic inflammatory disease, preterm birth, and even epithelial cell abnormalities. But of course, then we need to identify those abnormalities on the smear. So it is important to report this condition if we see the evidence of such a thing happening on the smears. The next thing I'm going to discuss is Trichomonas vaginalis. Now, Trichomonas vaginalis can be very tricky structures if we do not know how to identify them, because the morphological features are quite vague if you are not looking for them. So these are these pear-shaped structures, right? Pear-shaped structure with a kind of a cyanophilic to amphophilic cytoplasm. There is a nucleus which is very vague. It is not really very well stained. The staining would possibly depend on the quality of the stain in your lab. They're eccentrically located. Sometimes they might show eosinophilic granules in the cytoplasm, and sometimes they might show flagella, making the identification easier. But once again, as you can see in these pictures, the morphological features are rather vague. So you need to know how they look like, need to look for them. One important thing is that the background might be of great help in alerting the screener or the cytopathologist towards the presence of Trichomonas vaginalis. So this is another picture of Trichomonas vaginalis where the nuclei, eccentrically located, appear to be a little bit more clear. As you see over here, they often are adherent to the epithelial cells, which tend to show some degree of cytolysis. One very interesting thing, as I said, is to be able to be, to be alerted. Okay, so if you know that you are going to be alerted to the possible presence of Trichomonas vaginalis is from the smear background. There is usually, not always, a lot of inflammatory cells, neutrophils, which tend to produce this neutrophil balls, also called polyballs, or polymorphonucleocyte balls, right? And they're adherent to the epithelial cells. The epithelial cells tend to break up, and there is also a bit of vacuolation around the nuclei, but not to the extent that we are going to start thinking in terms of coleocytosis. Trichomonas vaginalis has been found to be associated with leptothrix. In fact, almost 70 to 80% of smears with leptothrix are known to be associated with Trichomonas vaginalis. Leptothrix are these long filamentous structures. They are non-pathogenic, generally speaking, and because of the combination of these long filamentous structures with these Trichomonas, they're often the appearance is often described with a tinge of humor, of course, as a spaghetti and meatball appearance. Now, there are a number of situations where one might mistake structures which are not Trichomonas as Trichomonas, and one of the commonest things that do so are cytoplasmic fragments. So cytoplasmic fragments are Trichomonas vaginalis look-alike. They do not show the nuclei. They do not show any flagella, which may not be present in all the cases. But the important thing to remember is that when Trichomonas vaginalis is present in a smear, they're usually present in large numbers, right? So when you see one or two structures which look like Trichomonas vaginalis in the entire smear, they're most likely not Trichomonas vaginalis. and just cytoplasmic fragments. So here are the notes on Trichomonas vaginalis. They have a paired to oval shape, nuclei eccentric and vesicular, cytoplasm pale cyanophilic with eosinophilic granules, flagella may or may not be present. Once again, eosinophilic granules may or may not be present. The associated features are neutrophil balls, cytoplasmic vacuoles, and of course I have spoken about leptothrix. As far as the DD is concerned, as I have mentioned before, cytoplasmic fragments are the closest DDs, but remember the Trichomonas vaginalis are usually plentiful, and one should look for at least one of the parameters shown above in red. So you see an eccentric nuclei, eosinophilic granules, or flagella. At least one of them should be present to be able to make a definitive identification of Trichomonas. Next, we move to the next most important organism, and sorry, not exactly importance in order of importance, but these are the common organisms that we find on cervical side. The fungal organisms, morphologically consistent with Candida species, where you look for the pseudohypae of Candida, right? Yeasts and the hypae of Candida. You can see over here without true septae. And then here are some of the changes that you find in smears associated with Candida. You can also find a lot of neutrophils, very prominent cytoplasmic vacuoles. And then there is another organism that is Candida glabrata, where you are not going to find the pseudohyphae, just find the globular yeast forms. These structures that you see over here are not the pseudohyphae, but rather lactobacilli. Right. So the notes on fungal organisms morphologically consistent with Candida comprise as follows. They're represented by budding yeasts and pseudohyphae which lack true septations but may show constrictions. Candida glabrata, on the other hand, only shows the yeast form surrounded by a halo, as you saw in the previous picture, without the presence of pseudohyphae. So if you just see the yeast forms, it most likely is Candida glabrata. Next in line are bacteria morphologically consistent with Actinomyces. These are identified by the presence of this pretty striking woolen ball or dust bunny kind of an appearance, which are shown by the presence of this filamentous structures towards the edges. See over here, and over here, this is a case of Actinomyces in a conventional smear which was associated with lymphocytic or follicular cervicitis. This is from one of our records. Sometimes clumps of lactobacilli may look like Actinomyces, and one of the things that might help us is the fact that outside the clumps you are also going to find some lactobacilli in the background, unlike in Actinomyces. So notes on Actinomyces: these are filamentous organisms with an acute angle branching. If you look carefully at the edges, they form cotton ball clusters. They may show neutrophil rich smears, but we are seeing less and lesser of this. So because it is much less prominent on liquid based cytology preparations as compared to conventional preparations, you do not see so many neutrophils. The main differential diagnosis is clumps of lactobacilli. Of course, I think most of us are aware of the fact that they are associated with intrauterine devices, and roughly 25 to 33%, or roughly quarter to a third of patients with IUDs will show the presence of Actinomyces, but it does not necessarily mean that the IUD has to be removed immediately, because it has to be correlated with clinical features suggesting pelvic inflammatory disease before deciding upon removal of IUD. So if one finds the presence of Actinomyces in cervical smears, it doesn't necessarily mean that the IUD has to be removed immediately. Only when there are other associated features of PID, the gynecologist will consider doing so. Next are cellular changes consistent with those associated with herpes simplex virus. Of course, needless to say this, we are not looking at the viruses, but we're looking at the changes associated with viruses. And these are the combination of changes that you look for. If you look at the chromatin, it has a washed out ground glass appearance. So the first feature that you look for is the presence of ground glass chromatin. The chromatin gets marginated towards the edges of the nuclei near the nuclear membrane. So it is called chromatin margination. There is also going to be multinucleation and molding. Apart from that, in some cases, you will be able to pick up the eosinophilic intranuclear inclusions called Cowdery type A inclusions. These are some of the other multinucleated cells that you might find in cervical smear. This is a multinucleated histiocyte. This is something which you saw in the previous presentation. This is a multinucleated syncytial trophoblast. This one, as I mentioned in the previous, I have some doubts whether it can be called a multinucleated histiocyte or whether there is just changes, reactive changes in the cervical cells. I'm not very sure. And this, of course, are the changes associated with herpes simplex virus. The main differentiating point is the presence of the washed out appearance of the chromatin and margination of the chromatin towards the nuclear membrane. If you find Cowdery inclusions, that's going to help you further. Now, one should be very careful about this particular slide or the changes that you see over here. So, the herpes-related cytopathic changes may resemble low-grade cell. We are going to talk about it again in a subsequent lecture. As you see over here, it is a cell with the shape of a superficial/intermediate cell. There's a very large nucleus which looks very abnormal, but if you look at it carefully, you will find that there is a kind of a washing out of the chromatin over here. So here it looks like a low-grade cell. Even in this cell, it looks like a low-grade cell. Here, it's a very scanty amount of cytoplasm. It looks like a high-grade cell. But once again, if you look at the nucleus carefully, you see that there is a kind of a washed-out appearance. And if you go and screen other parts of the smear, you're going to see other more convincing changes associated with herpes simplex. So notes on herpes simplex virus-induced cytopathic changes. I've already mentioned clearing of chromatin with ground glass appearance, margination of chromatin, multinucleation with nuclear molding and Cowdery type inclusion. The differential diagnosis includes low-grade cell and high-grade cell for the uninitiated. The DD from other multinucleated cells like multinucleated histiocytes, endocervical cells, and syncytial trophoblast you should be aware of. This is a picture from the Bethesda Web Atlas. I've actually not been able to, I've never really seen this during my practice. It may be found in immunocompromised women. The presence of changes related to cytomegalovirus on cervical smears. You can see this large cell inclusion over here. This is pretty controversial. This is one of our cases where we find the presence of a cytoplasmic inclusion very, very sharply defined with a kind of an opaque to translucent material within it, and there a bit of a eosinophilic center. So to certain cytopathologists, these are considered to be pathognomonic of chlamydia-induced changes. However, this is controversial because there are a number of articles which deny this. They say that no, this is not because of chlamydia, these are just mucin, so the jury is still out. But if I see such a change, I report it and I ask the gynecologist to use other confirmatory tests for chlamydia, right? So these are associated with chlamydia. There are other nuclear changes and even changes looking up to epithelial cell abnormalities, can also be found with chlamydia. But this is sometimes you may come across sometime under certain circumstances. So I usually, in our lab, if we see something like this, we report it as changes as suggestive of chlamydia, please confirm. Now, rarely we might find granulomas in cervical smears. There are some granulomas associated with infections. This was a case which was later on found out to be a case of tuberculosis involving the cervix, multinuclear giant cells and granulomas. This is a case which I picked up from the web from an article by Kalbus et al. And I have got a few other pictures which are going to come up later on. So if you want, you can go and look at this original paper which is available on the web. It is free. So presence of granulomas admixed with neutrophils, and then these structures, histiocytes, surrounded by an empty space with these very tiny structures which are the Donovan bodies, which are pathognomonic of granuloma inguinale. Very rarely seen on cervical smears. So, what are the causes of granulomas on cervical smears? It could be because, of course, infections like TB, granuloma inguinale, syphilis, number of fungi, amoebiasis, schistosoma, but can also be found, and there are reports of granulomas in Pap smear in cases of sarcoidosis. It may occur due to radiation and can sometimes be associated with malignancies too. So some of the other, we finish up with some of the other organisms which you might find. Excuse me. So this is the septate dichotomous branching of Aspergillus species seen in cervical smear as reported by Guijado et al. In Biomedical Reports in 2017. This is something which we rarely see. This is an article by Chandra et al. Published in Acta Cytologica, where you see the hyphae of Aspergillus with the presence of fruiting body. Not very commonly seen, so I just thought I'm going to put it here. This one is a very interesting fungus, Fusarium, and if you know what they look like, they can be easily picked up because they have a very distinctive appearance, and that appearance is been shown here as crescentic to sickle-shaped macroconidia of Fusarium with some transverse septation. This pic is courtesy Uzgan et al. Published in IJPM in 2012. I just thought I should put it here because not too many things in cervical cytopathology would look like this. So they have a rather distinctive appearance. So if you have seen them once and if you come across one such case, you should be able to pick it up. This is, a contaminant. It's Alternaria. It is a fungus which affects plants, but they again have a pretty distinctive appearance. They are brown in color. They have the shape of a boot or a snow boot with septation, right? This is from Clinical Microbiology Reviews written by Celeste Powers. This is another picture from the article published by Kalbus et al. This coccidioidomycosis showing round to tear-shaped fungal spherules and endospores. All these are pretty distinctive. So once you see them, you might wonder what these are. So these are very rare, but if you know how to identify them, it is pretty easy to pick them up. This is one of our cases, pretty old case, where he picked up the ova of Enterobius vermicularis. They have a very distinctive shape, is elongated to oval, slightly flattened on one side. Here is again one of our cases, a schistosoma ova of Schistosoma hematobium with this distinctive terminal spine of schistosoma. In this particular picture, you have the egg of Tinea. They're rounded spheroidal structures. Refractile, seems to have a double layer. Very rarely seen, but yes, you can find them on cervical smears. And here, to end this presentation, we have got something extremely rare and looks rather picturesque. Presence of molluscum bodies in pap smear. They are usually because of molluscum contagiation affecting the vulva, but they might contaminate the pap smear. And where you, in this case, you have these structures where we have these numerous large intracytoplasmic waxy bodies which push the faintly visible nuclei to the periphery, somewhere over here. So these are these very distinctive intracytoplasmic bodies. So with this, I end this presentation. In the next presentation, I'm going to start with some of the epithelial abnormalities that we see in cervical smears. Thank you very much.